This is what I was asked by Pat to come up with something a little different. So last week I had the opportunity to speak to the Wyoming HFMA, and it was on cash flow management. Now, that sounds fun. I know you all are hoping for that presentation. We can do that afterwards if you're really interested. We could do that one. So in that conversation, thought about what would make sense. So that's how we came up with today, from Excel to influence. The CFO is chief storyteller. So my journey, just a little more background. It is true I served 2 life sentences as a CFO for Pullman Regional Hospital. No, I got out for good behavior. So I'm a recovering CFO. But I'm really thrilled to be able to work for DZA, not promoting any firm or not. But the reason I chose that path, I wasn't done. It's an opportunity to give back. And really, that's what it's all about. So when we look back over our career, and I remember being interviewed on what does 38 years look like for you? In fact, I started Pullman Regional Hospital April 15th, 1988. Good day to start, tax day. As an accountant, it's always memorable. When asked about what's your greatest accomplishment, you would think, developing a first residency program at a CAW would be a milestone. Building one of the first hospitals from the ground up would be a milestone. Honestly, it's not any of those. It's about others. It's a very fact that I got to work with some amazing people in 38 years. Many that are truly family. I get a little choked up. Sorry about that. Because it's really the reinvestment to other people that really matter in your life. We will be long forgotten as CFOs, directors in time, but the people we influence will never forget. And I think that's the beautiful power of HFMA and why we are all part of this. I happen to beat you by a few years of being a member, but that's not hard. I remember coming to my first event, sitting in the room going, dang, these people have been here a while. And now I come in the room, I go, dang, I'm the old guy in the room. So, but we're going to talk about this chief storyteller. So, you did a great job storytelling. One of my slides, I want to point something out, and I think it'll resonate very well with you. But let me start with a story. I'd be really remiss not to. So, besides my career aspirations into healthcare and doing it for 38 years, let me tell you a little bit about me. I met my wife in the womb. Our mothers were pregnant together, and they played bridge. We were high school sweethearts. My father and my mother were high school sweethearts. My brother and his wife were high school sweethearts. My sister and her husband are high school sweethearts. My son screwed it up and met his wife a week after high school. I have 3 very lovely grandchildren. I have twin granddaughters. Shock, surprise. They were not expecting that, but they're a lot of fun. So we're going to embark on this journey together and talk a little bit about this. Wow, that was fast. We'll do it again. So we're going to talk a little bit about this journey in storytelling. I'm not either. All right. Hey, you. Let's try that one more time. It should come up. Because this goes right in with Kieran's thoughts, especially ties into this whole Star Wars aspect of what you started with. So I'm going to fill this in for a little while, and hopefully there's some words that come up here. Relatively short order. You want to hit enter one more time or advance once? Good. Good. All right, I'll put top. So, what are we trying to accomplish today? We want to make what we present meaningful to Aladi. And so I had great ideas that this would be, I bet, we're never going to fill in. But we're just going to fill it all in once. You can get the idea of it. But a long time ago in a hospital far, far away, CFOs fought endless battles with spreadsheets, Excel errors, whatever it might be. Numbers were reported, data was presented, boards yawned as they struggled to stay awake. Nothing changed until they discovered the power of story. So that's what we're going to talk about. I'm going to give you some ideas on how to think about changing your financial presentations. Now, I know many are doing that today, but this is exactly what Kieran was talking about. And as he told stories, he related it to life. So once upon a time, every great story has a hook. So do your financial presentations. If they don't, they're meaningless. Hate to tell you that. Is your board asleep? If they are, it's not their fault. It's our fault. This is fascinating. And no shame here. 79% of people don't remember a single fact from the last presentation they heard. Wild. 8 people will walk out of this room and not remember anything unless we tell a story. Stanford Business School just did a study. People are 22 times more likely to remember a story than they are a single fact. What does that tell you? It is in our brains where we relate to stories. That's where it lives. When we're presenting financials and we're just presenting data, tell you what, it's meaningless. You have to relate it to who you are. What's your mission? Why did it matter? How are you driving and changing healthcare in your community? If you're reporting just data, people will walk out, they won't remember the main thing. So here's the challenges we face. If you thought you were going to get off scot-free, you're going to be a little uncomfortable at table discussions. I'm going to sneak out now. Don't stay. I promise you, you'll remember a lot more. The challenges that we face are numbers are never inspiring alone. Stakeholders need context, not just data. Missions and financial health must be connected. And that's your job, a financial being. Connect the data. Sometimes taking very complex discussions and almost simplifying them so people can understand. So then you can get actionable items. Stories build trust. Spreadsheets don't. All right, so what's this journey we're going to go on this morning? Here's the agenda. Here's our roadmap. We're going to talk about the problem, data dumps that don't drive decisions. We're going to talk about solutions, how to frame it up. How do you tell the story? What does that look like? I would have loved to have pulled up a quarterly financial for you just to give you an idea. Happy to share that with you if you ever have an interest in it. But how did we relate that? I didn't have the opportunity to play. So, I wanted to make sure we had enough time for our own journey here today. The proof, real transformation examples, and that's where we want to talk about some of the things, and I'll give you some of that examples. And then your takeaway. What do you take home so that you can remember at the end of the day, what do we do with the information that we're about to share? Okay. Now, the information you see is made up fictitious information. It's to protect the guilty or the innocent, however you want to look at it. It's just numbers. I know those finance people will go, doesn't make sense. The graph goes up, but that went down. I don't quite get it. It's all right. It's irrelevant. We're talking about context. So, yes, I'm one of those accounts that see things. I don't know if you notice this. You have 4 sconces on the wall. One of them's missing an arm, and I feel so sorry for that sconce. You may not have noticed that, but I did. That's like 9 M&Ms. We have these idiosyncrasies in our lives on the part of it. But I've seen this before. I'm going to tell you. I've seen financial reports just like this. This one's actually pretty cool. This one's quite visual. A little dark for the back of the room. Apologize for that. I didn't realize black and in a very lit room would be this much of a challenge. It looks really good on my screen home. But you look at the financials and it's very appealing. It's got some cool graphs to it, very visual. It's got some ups and downs. You've got gross operating revenue went up $4.2 million. It increased 8%. Our expenses were up 3.9 million, 12% over last year. Our net income overall went down by 182,000, a decrease of X number of percent. Again, the numbers don't really matter. We've got a little dashboard over on the side of our key metrics. How are we doing with our AR management? How about patient volumes? And then we tie it to our budget. And we look and we say our gross revenue was up, it increased. This was down, it went down. Cool, really visual. But what did it tell our audience? Absolutely nothing. Lot of information. I just recently was looking at a financial 21 pages of this stuff to that board. It went on, looked a lot like this. Really cool. Actual budgeted. It even had last year. And lots of arrows, lots of color on it, ups and downs. And this is what our boards see today. We'll throw a balance sheet in there just for perspective. So that cash went down. That's a challenge. We'll talk about it. We might even put some things in there because AR went up. But again, it doesn't really share context. So I'm challenging all of us to think differently about that. But we've all seen this, right? I think if you're beyond this, then this wasn't for you. I apologize for that. I have been guilty of doing this myself in the past. So we'll look at statistical reports. It has data on there. The boards look at it and go, cool, we're up. We've seen more volume. That's really cool. And sometimes we feel really good. Our financials are good or bad. And we'll share a little bit of why, but that's about it. So what's wrong here? Number one, no context for why. And I think that's our biggest challenge. I remember I had working in a university town. You often get some board members that come from a professor background. I had one professor, he challenged my very first board meeting. I remember this. In fact, it was a day we were trying to merge two hospitals together, and it failed miserably. The communities were very much wanted their own hospital in the communities. And the CEOs were talking to the university for president. And at that point, he pretty much got on the table and said, over my dead body. And that was just enough for both of the boards to go, we got that ball over, just going to go back to our meetings. So the CFO at the time went back to the other side of the state line. And I was on the opposite side. That's how I became CFO, just kind of shoved into it. And by the way, you get a board meeting tomorrow. Oh, cool. So I started the board meeting and said, hey, sorry, the CFO, he's no longer going to be with us, so I'm here to present. And that president pulled me aside and said, don't ever start a meeting by apologizing. I never apologize to you. That's my wife. No, I'm just kidding. She'd honestly laugh at that because there's a lot of truth to that, I hate to tell you. But the reality of, after that point, he would ask me why. 300 times I'd be like, oh my God, stop asking why. But the reality of it was, let's get to the root cause of the information. So literally, it really challenged me outside the box to just say, well, AR went up by 3 days because we saw more revenue. Really? Makes sense? Oh, no. So a lot of those questions is why. No connection to the mission or patient care. Does your financial report connect to that? What's your one-page plan? What's your strategic objective? And are the financial results for whatever period of time you're looking at aligned to that or not? And then why not? No actionable insight provided at all. Just data on a page. So it's just symptoms. I think I relate to this with it being a father that's a doctor, but no doubt. Here's the symptoms, but we don't ever look at what is the problem. So what if we look at this differently? That's what we're going to do today. We're going to look at it differently. So let's look at this afterwards. Now, again, I would say there's a lot more detail behind this. This is just to give you a flavor of an idea of how to do this systematically different in your own presentation of mind. How deep do you go on a monthly basis is totally up to you. It's up to your board. It's up to your audience. Know your audience. But what if your financials started something like this? Our story in one sentence. We invested in our community this quarter, expanding access to 1,200 new patients, and the financial results are complete. Now you're connected it to your mission. Now you're talking about what you influence within your community and what that looks like. Now when they go to see this chart and they say, oh, 1,200 new visits. Now they know why. Oh yeah, we did. In this scenario, let's just talk about it. We expanded our urgent care to include weekends. So that all of a sudden you tied it to what you did. It expanded our cardiology specialty services. We enhanced our diabetes management. So now when they're looking at the financials and they're seeing 1,200 new patients this last quarter, and they're seeing 340B improve because of the diabetic management alignment, now they have context when they see that information, right? Now they can look behind it and we can just say, did we make the right decisions and how do we improve that? Also, in addition to that, by aligning to our mission, we were able to see 28% increase in our unserved partners. So, man, we're tying it back to the mission that you're trying to do in terms of the health of your community. So, this is what serving your mission in practice looks like. What is the cost? So now we begin to dissect that. And we look at it. My goal overall in the financial report, my financial reports, by the way, are a little bit long. I will admit they're a little long-winded. But I wanted the board members to be able to go to the section where they had the question and get their answers. If I didn't do that, then I probably failed at really explaining it. Not that the board members would read all of it, but collectively they would. That way, when we got to a board meeting, it was meaningful conversation and I wasn't just regurgitating financial results. So in this, start looking at increased operation expenses. Why? We had additional FTEs. Now we start looking at financials and we go back to that early report. We see that salaries and wages up. Now we can connect it. Why did we have an increased FTEs? Well, result of adding those new services. Now you're beginning to connect your financial data to this tree. And then ultimately how it impacted, that's probably better. Yeah, use this. Impacted your community. The financial reality, growth phase pattern. So look at your key indicators now and begin to say, what are we doing about this? So AR is up by 53 days. Well, we expanded the service. We saw new patients. We are not quite there yet in our productivity from capturing the charges effectively and then billing appropriately, blah, 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 blah. So that you begin to be able to then share those connections down the road. So now your key financial indicators make sense instead of just being information on a page. Why this matters. So when you're looking at the report, so what? Patients went up. Well, had we done nothing in our community, 1,200 people would not have been seen or would have done somewhere else. So we would have lost market share. In those 1,200 services, what else does that mean downstream for us? Give you an example. One of the advantages I had at having conversations with physician practice that wanted to align, they were fiercely independent for decades, and that was fine. I mean, as long as they might be independent, great. We wanted to support them. They got to the point where they're like, hey, by the way, it's December 20th and we're going to close December 31st. Hold on. You got 11 providers. And not going to be good for our community. But we got them to the table to start talking. Come to find out, we were losing significant amount of market share because our system was so broken. We had put so many barriers in place, but we got them to the table to start having conversations. So we could talk about this is what's happening. If we don't do anything here, this is what we're going to lose to our community. What is the future access? And it's really important for access sometimes, I guess. What's the mission misalignment that we go, our goal is to serve our community and we're going to a healthier community, yet we don't have the ability to do so. Are we fulfilling our missions? Or are we not? So then versus the building, we expanded it. This is expanding our footprint. We were able to protect our market share. As a result of that, this is where it positions us. In the scenario I was just talking about with this physician practice, it meant an extra $2 million of loss per year by employing those docs. That's tough to swallow. But we picked up $4.5 million in revenue that was going outside our market, and we offset that cost. We preserved healthcare. And we didn't need that much. That wasn't our goal. Our goal was to preserve healthcare for our community. So now you're going to develop your pathway to sustainability. So now you've talked about the why. So what? What are you going to do with this information? Again, your financial report should include where you want to go next. Okay, this is what we're going to do with the information we have. Some of it, if it's great, keep going. Some of it, if it's not so good, and it's okay to share the not so good, this is what our action plan is. Makes you personally accountable to that. It brings transparency to your board. And in a lot of situations, trust. Okay. You may not always get there. You may find out, oh, we couldn't quite hit that mark. That's okay. Share it. I have found most boards pretty forgiving. But when they don't know information, it's a little more of a challenge. That's when oftentimes you're looking for. So this is an actionable item. So our revenue cycle optimization, we're going to deploy, AI in terms of denial management. We're seeing X number of percent increase in our line item denials. Maybe you're not seeing it in full denials, but we are, in this range. This means, so many hundreds of thousands a year. By doing this, we expect to capture. And then you measure that and you report it out. Payer contract negotiations. We've sat on these contracts for, how many ever years now, and we haven't renegotiated. Maybe it's time to look at it. Maybe it's not. I'm going to tell you, some of your contracts are probably pretty good. They're percent of charges. You probably don't want to go back to the table and ask for something more. Maybe, maybe not. But this is your pathway. This is what you say with your presentation of what we're going to do. So then your financial summary looks more like, here's our positive, and these are areas that we need to watch in order to improve. Again, the actual information here is less about exactly what the words on the page are, is what you do with your information and how are you presenting that to your boards. I had a financial effectiveness plan that I shared with my board every quarter. What did we do? What didn't we do? Were we on track with that? Did we make the progress we had anticipated to, or did we shelf that for now? One of those items in our particular market, I should probably say this, but for some fictitious hospital anywhere, any town, I'm like, you should really create an urgent care on the other side of town because somebody's going to come do that. And we ought to be thinking about how does that really project. We wanted to expand our ED. And I'm like, yeah, but 43% of our volume through our E&M coding shows that it's low level. It's urgent care. If we offloaded that, we don't have to build a really expensive hospital setting. We can reduce the cost and we can still serve our community. And it also preserves market share. That's the conversations that you can have as a result of that. So your mission plus discipline equals sustainability. We expanded our services. We served 1,200 more patients. We absorbed the growth cost prudently. We're a little behind. We didn't quite expect we'd run into this issue. This is our next quarter, next 6-month plan, and we want to optimize it now for sustainability. So we'll continue to share with you, board, how are we doing on that path. So the transformation from reporting what happened to explain why, and then getting to the so what. What do we do with this information? All right. This is your takeaway. These are the 3 things I want you to put on your computer next to your financial slide deck, whatever you do for your boards. These are the three things you should think about. Context. What is happening and why is it happening? Second, connection. How does this link to our mission and our care? What does it mean? We sustain 30 positions in our community by doing this. We were able to grow and sustain X and serve our community better as a result of. And then the consequences. What happened? Did we achieve our goal? Is it making us more sustainable or less? So it's that whole area of transparency efforts. Okay. So those three things, there's your takeaway. If you got nothing else out of it, write those down. This up on your slide deck. Next be your financial reporting and see if you can answer those three questions. So case studies. This is where I'd love to hold up the financial. One thing I I used to do is quarterly I would focus on a certain area. So, you have your HR and I pull up HR. How are we doing with retention? How's our retention rate? Next quarter might be physician practices. What are we doing within our physician practices, and how are our physicians feeling connected to the organization? Are they connected? Are they not? What's our access? Are we struggling with any of our clinics in terms of access? Do we have longer than we expected times to get in? Maybe the next time it was on patient care. So I just kind of go through the list and figure out which one made the most sense to really kind of almost pull out and focus on. So that you connected to all parts. It wasn't just financial. A lot of my presentation wasn't financial alone. It connected all pieces because it all connects together. And if we have good quality care, we should see more patients, right? I mean, ultimately, you're providing a good product. People should want to come to see you. If you're coming to see me and I'm not taking care of your needs or, God forbid, killing you or your family members, we're probably not going to last very long, right? So it's important to tie all that together. Contract. CFOs use analytics to uncover recurring payment underpayments. Armed with evidence, now we can go renegotiate. So I remember hearing this when I did some Six Sigma training and to make it was, in God we trust, all others bring data. And there's a lot of truth to that. Bring the data, show me the fact. I mentored a young man to, now he's CFO. And I'm sure I know the half of him, but to this day, what's my source of truth? Show me the source of truth, and I just drive that home. I don't think you're quite there yet. That doesn't quite seem like the source of truth to me. I need to see the source of truth. Get me all the way down to there. Well, okay, go back and redo it. No, until I'm like, okay, now we have good data. Now we can make good decisions. 8% reimbursement increase, therefore yields X dollars. So this is the information you're sharing with your board members. Make numbers cumulative. And when I think about life and I think about leadership, so lead now. Your organization has a vision of where you want to go, correct? As a person, you should have a vision of what you want in your life. Where those two things overlap, that's the shared visions. That's where you touch the heartstrings of the individual you're working with. And that's what you need to focus on. We want to drive your organization to improvement, figure out where that aligns, and you'll be shocked at the success you have. So some ideas, 340B savings, funded diabetic education, and we saw 500 patients. Now we connected it to our population. We didn't say, hey, by the way, our 340B program is doing great and no, we tied it to our mission again. Margin improvement kept the ER open. That important for your community? Now you're connecting it. Now you're telling the story. They're going to go away remembering that, unlikely to be asleep at your next finance presentation. So your storytelling toolkit, start with why before showing what. Connect every metric to patient impact. What did it do for our patients? What did it do for our community? Use comparison. So use these comparisons that stakeholders understand. You may get it. You and I may be able to look at a financial report and read it. I just did a presentation to a board saying, "This is your job. This is what you should be looking at. These are the questions you should be asking your CFO. They're not asking or telling you." So just helping them understand how to even read the financials. Most of these people are volunteering. They have no clue. Or they do. They may have a different idea, but many of them are in healthcare. So understanding that piece and then helping tell that story, connect it to them. The end with a clear, actionable next step. So what are you going to do with this? What are you going to, what's your results here? Okay, perfect. It's your turn. We're going to pass out, not literally pass out, but we're going to hand out 3 different scenarios. You get random choice of scenarios. You get to, at your table, put together your story and tell the board what. If we have time, maybe we'll ask a volunteer to come up and share what the results are. If we don't, we'll complete a little early. I know it's lunchtime. People are getting a little hungry, probably tired of listening to me. So this is your opportunity to shine. Well, I appreciate you all playing today. And the 3 scenarios that we had were accounts receivable spike. So accounts receivable, this is what the board typically would see. Accounts receivables increased by nearly $1 million. Days went up from 52 to 59 days. We had budgeted 50. We didn't quite make it. We had a 7.4-day increase. So that's a 14% change. So it was your goal at a table to use that one to tell a better story. The next one was revenue decline. It's a mystery. Patient revenue dropped 10% compared to the prior year. We've seen a decrease of 1.2 million. Volume analysis shows primary drop in OR billable minutes. Surgical cases are down 28%. The final one, or last one, was cash position declined. Days cash on hand dropped from 126 days down to 99 days. Let's start doing layoffs. No, that's oftentimes what we see CFOs, right? 27-day decrease. We're below our industry goal or our benchmark. Some of us would dream to have that benchmark, but this hospital too. And our cash balance now went down by 3.8 million. So it's your job to tell a story. Anybody want to volunteer what their group did? No shame. I know one of you is just dying to do this. Where's Jesse? Because we need to volunteer somebody. He's not here today. Anyone? Go for it. Thank you.
But the camera's duty, the mic.
Okay. I'm afraid of what's happening. Well, okay. We chose scenario 1. Gee, board members, you'll see from our report that our accounts receivable really spiked. But we've got such a great relationship with one of our 3 top payers, and they were very kind to let us know that they were changing their system. And they weren't sure if there was going to be a blip or not. Well, we saw the blip. So we were able to sit down, negotiate with them that by showing them how many claims have been stuck in their system now for many months, that we cannot really survive with a lack of 1/3 of our cash flow coming in. So they were very open to write us a check that we'll have to reconcile later after we get that and all the cash starts flowing in after we work on the AR. So we definitely, it's paid off having that type of relationship with our payer.
She has land in Arizona that is seaside. It's very nice. Now that tells a story, right? The board can relate to it. You have actionable item, which is cash coming in for now. You're going to reconcile it. You'll continue to share with the board as things progress. Hopefully they get their system working out and your AR will go down as a result. But right now, your cash is good and you're going to be able to sustain it because they're going to help pay you money, right? But your AR is not going to look it for a while. So that's the story. That's we now the board can relate to that. They can understand. You you volunteered. Now you changed your mind. You can't take it back. Anybody with a different scenario? Fair enough. All right. All right. Going once. Oh, anybody have the orthopedic surgeon retiring scenario? No one? I'll go for it. All right. Appreciate it.
About of the peer pressure at the tip.
Appreciate that. Thank you.
So speaking with the board, board, as we've been talking for several months now, we were aware that this physician was reaching the age of retirement, and based on your guidance, had a soft recruiting. It was a little bit unanticipated and unexpected that they would leave so soon after announcing their retirement. However, we also had in the background some locums set up to take care of this. Some of the issues we're dealing with, though, are a significant loss, a third of the loss of OR time or OR cases. However, you will see through this, though, that we were actually able to gain in other surgical areas. While we lost orthopedics, we only were down 28% instead of the 33% because we were able to add on cases in with GI and also general surgery. So it's not as bad of a story given the unforeseen circumstances we've encountered, but we have also started partnering more with our in-community physician group who is picking up the slack. But we believe that with the proper recruitment, which we have a new physician coming on at the end of the year, and the competing group in the community has agreed that if we buy them that new Mako robot, they'll actually bring more cases back to us and start doing more cases here on site instead of in their ASC. So while this is a negative impact and timing-wise unexpected, we have been able to look into the future and actually grow market share by having this Mako come on site now because that retiring physician wasn't interested in new technology.
Love it. To add on to that, as a CFO, now you have opportunity to sit down with marketing. How do we market this? How do we make sure our community knows that this is happening? So it really opens up again that line of communication because you're beginning to, see where these connections occur. Appreciate you all for doing that. So remember this again, numbers tell you what happens, stories tell you what it means. And I'm going the wrong way. So we're going to go back through the presentation. Again, thank you so much. Appreciate the opportunity to come speak with you all. Happy to be of any help or service down the road. Again, I hope you enjoy the HFMA event. Great attendance, great turnout. It's good to see many of the colleagues that I've ran the circle with and to meet new ones. So appreciate you all. Hope you have a good rest of your afternoon and a good lunch.